my ideal world, my wish list of how we could educate people is to do more VR training. So maybe that can be your next big thing. But I think it'd be so cool if we could VR train people on PPE and donning and doffing. I think that would be the next big thing for healthcare. We could do all sorts of things VR in the future.
Rising above the buzz of ultrasonic cleaners and the clanking of stainless steel are the ideas and voices that are changing the industry. You're listening to the Beyond Clean podcast, the central nexus for people, processes, and products that are improving our sterile processing world. Each week, we speak with frontline technicians, CEOs, engineers, and entrepreneurs with a common goal to help you fight dirty every instrument, every time. Whether you're tuning in for education or inspiration, we're glad you did. Now, turn on those washers and turn up the volume. It's time to go beyond clean.
For this episode of Beyond Clean, we are going to be having Jill Holdsworth to help us wrap up this season all on PPE. She's the manager of infection prevention at Emory University Hospital Midtown. And Hank, she's obviously done quite a bit of education on the Beyond Clean platform, participating in virtual conferences. And, we saw her last year at HSPA's annual conference in San Antonio. And today we're bringing her on to really help us wrap up this whole conversation on PPE and why infection prevention is so critical to engage. And she's going to tell us about some ANSI AAMI standards and guidelines coming down the pike or already in place.
Yeah, Justin, super excited to talk to Jill today. She is a member of the Beyond Clean Advisory Group, so she's contributing in a number of ways to educating not only our audience, but the global sterile processing audience out there. And she is near Hotlanta, Georgia, which is the world headquarters for all things infectious diseases, right? The CDC is right down there. If you're a fan of The Walking Dead, it's all coming down to Atlanta, and that's where all that kind of zombie chaos is going on. We're not going to be talking about zombies today, but, we're going to be talking about protecting ourselves from infectious disease through best practices around PPE, and in particular, how that collaboration with IP can help equip sterile processing to do that well. So this is going to be a fun episode and a great wrap up to a fantastic season of armed and compliantly dangerous, all about PPE. So yeah, let's get to this conversation.
All right. Up next, the zombie apocalypse. No, just kidding. Jill Holdsworth, stay with us. I'm Justin Poulin.
And I'm Hank Balch.
From 17 Studios, you're listening to Beyond Clean, the global voice of sterile processing.
We are speaking with Jill Holdsworth, manager of infection prevention at Emory University Hospital Midtown. And Jill, the last time I saw you was at the HSPA conference about a year ago. As a matter of fact, I think that was the first time we met in person as well. But it's great to have you on the Beyond Clean podcast. And I know this is only audio, but we actually have video while we record, and it's good to see your face again.
It's great to see you too. Can't wait to see you all again in a couple weeks.
I know, it's coming right up. This episode will actually release after that, so there'll be probably lots of good stories that people will have from our trip to the conference. And, I wanted to talk a little bit about your background, because in this whole season and in the context of PPE, personal protective equipment, we're bringing in the voice of infection prevention. And, I know one of the major challenges, especially over the last 3 years for IPs, was simply the re-education and constant re-education of hand washing and the importance, and maybe not even just in your work, but in your community and with the people that you love and see every day that maybe have not had the same kind of training. I'm wondering if we have similar challenges with PPE from your perspective. So welcome to the show.
Yeah, thanks for having me, guys. Of course, there's challenges with retraining and training. And of course, with just to start a little bit with my background is actually in exercise physiology. So I started out not being in infection control at all. So I was kind of on the other side too. I can remember people coming in and saying, we're watching hand hygiene, or watch yourself for hand hygiene. And we marked ourselves compliant all the time on every audit we had too. So I totally understand what people are going through. When I can remember having a piece of paper and they would say, when you come back from the bathroom, just mark that you did your hand hygiene. And that's the audit we turned in. And it just makes me cringe now thinking that that's how we measured ourselves. So when I turned into an IP by chance later in life, it just makes you look at it a totally different way. And I also say that because IPs can come from all walks of life. You do not have to be a nurse. You don't have to have an MPH. I have a biology degree and a master's in exercise physiology, and I became an IP. I don't have an MPH. I still got certified in sterile processing, and you can do whatever you want to do if you just put your mind to it and you want to do it. So if you're somebody in sterile processing and you want to be an IP, figure out how to do it. Figure out what you need to learn, and you can do it too. And we have a lot of folks in sterile processing that have wanted to kind of go into that path. And I think that's incredible. And maybe that's a different discussion for another day. But looking at the challenges with PPE and re-education on PPE, we've really looked at that hard these last 3 years as we've had supply chain shortages. And right when we got comfortable with one gown, we move to another gown, or we move to another mask, or something else happens and we have to start using something completely different. So the challenges with education are endless, and we're not out of that yet. We are still trying to figure out how to keep people safe by keeping them comfortable with what they're using. And that is going to be a continual struggle with us, to be honest, for probably years to come, because we're 3 years into it now and we're still not to the point where we can say we're in sustainment mode, because supply chain shortages are still very real.
Yeah, it's so funny that you bring up that supply chain piece, because in an earlier interview in this season, we talked to Matthew Frederick on kind of the perioperative business manager / sterile processing manager perspective on PPE. And so we were talking to him kind of on the business end of PPE and, what happens if you can't get what you want, and like, how do you trial, and then obviously on kind of the frontline user side, like, what do you prefer and what's that safety side of it? But you brought up, there's an IP component too of when these products change, sometimes like that changes the education and changes the documentation and the auditing, and like all of that's just wrapped up into what you would think is just, it's a simple product change. You're currently using the gown. We're going to give you a different gown, and there you go. Nothing going to shake it up. But that's not reality, to your point. And to do that again and again and again over recent years, because of the supply chain issues, I mean, that has got to have weighed heavily on the backs of IPs.
It definitely has. And we've had to consider things that we never thought we had to consider before. Like, how do you train people when you're in a supply chain shortage? And there's this image that I'll never forget, that we had a big auditorium full of people from the operating room, and we were doing gown training, and everybody had a gown. And we were making sure that they knew how to don and doff the gown. This was before we were worried about gown shortages in the pandemic. And I just can't believe we wasted all those gowns on the training. and I'll never forget. I mean, it was a couple hundred people. And now we've totally rethought how we do, PPE training like that, because we don't want to use so much PPE to do the PPE training. But then how do you effectively train people on PPE if you're not going to actually do it? So it's really a hard thing to figure out, how to train people when you don't want to actually rip the gowns off like you're supposed to. And
I actually want to go into that, because you brought up, I had not considered that training topic, but this whole thing has a training component, like this whole season has a training component. To your point, there's a supply part of that involved, but then there's a cost involved too, right? So like, we don't want to waste the gowns, but we also have to buy the gowns, but we need to train for our staff for compliant use. So how did you work through that? Like, I know you brought up gowns, but this is applicable to any piece of PPE that you're training for anybody. So kind of walk us through that.
Yeah, so we started, I'll tell you kind of what we're doing now. We've started looking for our highly infectious disease training. We've started looking through older supplies and using anything that might be expired, that kind of thing first. For gowns, we've been trying not to rip them, trying to simulate more. And if we can use anything again, so for like the highly communicable disease training, we're doing more of like a Tyvek type suit. So that kind of stuff, we can simulate how you would doff it and then use it again for training. We're using more video trainings, which again, some of those things aren't quite like the real thing. We can do a lot more just-in-time training. The IPs are always out on the floor. Something that we do is we're always out on the floors in the units. We can always be out there just to kind of see if we see something that's wrong. We'll do some just-in-time training. So that's something that we do in the ORs and sterile processing as well, just to make sure that, if we see something wrong, we can say, that's not quite right. Or we like to have a lot of people trained correctly so that we can always have buddy donning and doffers so that they can always be watching. And I think that's the ideal situation too, since we can't necessarily have in-person hands-on training all the time with every single PPE scenario. Your buddy should always be that person kind of having your back.
I want to leap off of that real quick, just like kind of the psychology of PPE. And, when you get training, a lot of times people are like, oh yeah, this is the ideal world, but this isn't what we really do out there. Right. And they kind of take shortcuts or whatnot. And it really makes a big difference, right? Like sometimes I think people don't realize like that's what you should do. What you're being trained to do is the standard that you should do every single time. But people let it slip because they're like, oh, it's training. This isn't a perfect scenario. So if we do 80% of this, we're doing good. And, how do you combat that?
Yeah, that's really hard because people are in a hurry. I will talk about this a lot in decon especially, or when people are ready for their breaks or they're ready to get to lunch. But the doffing is the most important part. And that's the part you really need to slow down and you need to do very carefully, because that's when you have the highest risk of contaminating yourself or exposing yourself. But that's also the time that I think you're really trying to get out of the PPE the fastest, because you're hot, you're sweaty, you're hungry, you've got to go to the bathroom. And so you're really wanting to get out of it fast, but that is when you really have to slow down. And so that's where training, consistency, it really helps to be able to have that kind of discipline to do it over and over. That's why we have to talk about it so often, because I'll see people just rip it off and not even pay attention to the order that they're doing it in. But the doffing order is so important. And so we do have to talk about it all the time. We do have to retrain all the time. And that is the hardest thing in healthcare right now, is retraining, reiterating, and follow up on any training, not just PPE training. But I mean, think about all of the things going on in healthcare right now, all of the changes, all of the things that need to be educated on, and making sure people remember and retain anything right now is so difficult.
Yeah. And think about where you're going when you doff that, right? You're going to the cafeteria. You're going to public spaces that patients and their family members may be occupying.
Or home.
And so or a home. But even if you just think about the cafeteria and people who are immunocompromised being in there, and even just the business of healthcare, that if you were to spread something to them and then they were to get sick and have an extended stay or go home, the next day only to get readmitted, all of those things really hurt the hospital financially and, really could impact somebody's life. And so it's not like you're doffing it and then going and washing your hands and putting on another gown and going somewhere else and continuing to kind of protect others. You're literally carrying that with you through the hospital.
Yeah, what I have found with adult learners is they really need to be able to make it feel something to them. And that's why I mentioned you could be going home to your family, to your kids, to your mother who is sick. And for some reason, and I say this because with hand hygiene, we sometimes can't get it to connect with them that, oh, this is what's safest for your patients and to the rest of the staff and to the hospital. But if you connect it to what's really important to them, then it really matters. So when you doff, you have to do this because it's what's safest for your kids, to your parents are taken care of. It really starts to connect to them that you could be taking something home and you don't want to do that.
Yeah, Jill, you brought up those training gaps, right? So like the example you just mentioned is kind of your why, like why are we doing this? And the why can be different and is different often for everybody, but identifying that's key. But then you also brought up, there is this retraining gap. So like we've told you once, you've been onboarded and trained, we've signed you off on your first competency, but then you're still working here, 6 months later or 12 months later or, 2 years later, and you've been given a lot of other information, a lot of other duties along the way. Do you still remember that one time that you got training on your mask? For instance, I'm going to take a selfish plug here for podcasting, because one of the things that we have just seen so much success and momentum around is starting to break down that barrier and assumption that there's only one way to educate, and that's through a PowerPoint presentation. And if you don't have a PowerPoint presentation, it's not real education, right? That was kind of, I won't say like everyone had that conscious assumption, but that's how we were operating. Is you got a textbook, maybe, and then you got PowerPoint presentations, and that's the extent of any type of education or re-education that is going on in our industry. And like through podcasting now, there's like 10, 12, 15 podcasts just in sterile processing today. And what we're seeing is we're talking about the topics that are being onboarded and oriented, that are in the textbooks now, that are in the standards, that have a lot of PowerPoint training around. But then people are listening to these conversations like with you today, and they're saying, you know what? I have never thought about training for PPE and the costs involved and how to manage all that product waste. And in fact, I'm an example. I have never thought about that until this podcast. So this is not hypothetical. Like these kinds of audio-based conversations are really pushing the needle. And the last point I'll say, and I'll kind of kick it back to you to see like what other multimedia gaps or multimedia training that you've considered or kind of dreamed about. But with audio, it's the only form of education that can be consumed while you're doing something else. You can be walking, you can be running, you can be driving to work, you can be on your break, eating, and you can still be getting educated without having to be sitting in front of a computer screen or even sitting in front of a trainer. So yeah, have you seen the same thing I'm seeing, or I'm just this podcast geek over here?
Yeah. And it just made me have this thought, like my ideal world, my wish list of how we could educate people is to do more VR training. So maybe that can be your next big thing. But I think it'd be so cool if we could VR train people on PPE and donning and doffing. I think that would be the next big thing for healthcare. We could do all sorts of things VR in the future. But I mean, you're absolutely right. We went from everything had to be webinar based and PowerPoint based because that was how the pandemic taught us. And now people just don't have time to do a full webinar, but they might have time to listen to a podcast on their way to work, because a lot of people commute, or even while they go on a walk after work. And that's what I do sometimes while I'm, going on a walk or doing housework. That's when I'll listen to podcasts and things, because that's just where I fit it in. I may not have time during the workday, but I have time when I'm doing kind of other things. And it's kind of like the new age of continuing education. You fit it in where you can fit it in. And I think that's kind of just where we're going. And I think it's great.
So we jumped in this interview very quickly, but I did have a couple of questions kind of set the stage, and you've danced around a couple of them, but I just want to throw them out there. So with infection preventionists, right, what role do you play or should you play specifically regarding PPE across the hospital and in particular sterile processing? So like you mentioned training, but like what are those other responsibilities and aspects that we want to call out here?
Yeah, well, so when we talk about just the whole hospital in general, IPs are out there every day. We're looking to make sure that people are wearing what they should be for the right rooms, for the right isolations. And so that's kind of a big part of our job every day in general across the whole hospital. When we talk about SPD in the OR and our procedural areas, it becomes a little bit more intricate because this isn't an isolation-based PPE scenario. This is more, what should they be wearing in what area and to make sure that they're protected. And so this becomes a little bit more of a making sure that we're following our protocols, but this on a day-to-day basis, it's are we following our protocols? On a more long-term basis, it's what is the best PPE for the area and are we getting that? Do we need to look at different items? Do we have back orders? And so the last 3 years, again, we've had certain back orders of some of our PPE that affected sterile processing that we've had to look at. And so we've been involved in those. And so as IPs, those are conversations IPs should be brought into. So if they're not, they should be. If you're in sterile processing and you don't involve your IPs in those conversations, then you should, because your IPs could and should be advocating for you on those types of things. And then just once you put all of that extra PPE on, I always tell people to advocate for this. What are you feeling? What are the techs and SPD feeling? Are they too hot? What's the temperature in there? Because we know that once you get all of that extra PPE on, it's very, very hot. And so I always advocate for the temperature, even if you're operating within the range. Operating at the top of the temperature range in sterile processing and decon is not always optimal conditions because you're still very, very uncomfortable.
And those nuances or the complexities, I think maybe you called them about these specific procedural areas. I'm assuming that IPs they're not born knowing those things, right? So like baby IPs here just got hired, being onboarded. How do they learn? Like, what's the process? What are the resources out there? And I want to tie this into something you said earlier. Like, we've got a lot of people listening to this interview who are probably thinking, hey, that could be a career growth opportunity for me. So kind of walk them through like what that learning experience would be if they're maybe in the OR and they're thinking, yeah, I want to do IP, but that includes the whole house, not just the operating room anymore.
Yeah, it's a great question. And if you're in, say, sterile processing and you want to learn more about IP, the first thing that you should do is contact your IP and ask them to shadow them, because there is a whole world outside of the procedure rooms that you have to learn about that's on the floors. If you're in IP and you want to learn about sterile processing or you want to learn more about the operating rooms, then I always say you just have to spend time there. And really it goes both ways. You have to spend time in the place that you want to learn more about. You can read about this stuff all you want, but nothing is going to do you any more good than just spending time in the place with the people who do the work. And I always tell the story of when I first had a hospital. I was a sole IP. IPs like to call them the oneers. So I was a oneer, and I had never been in a sterile processing department before. So I just went in there and I said, hey, I'm Jill. I'm the new IP, and I have no idea what you all do. Can I just stand here and watch you guys today? And they were great. They let me just stand there. It was in the prep and pack area, and they were wonderful. And I ended up spending a lot of time there because it was an area that was totally foreign to me as an IP. I had no idea. And I feel like as IPs or as just professionals, we need to be able to be humble like that, just to be able to walk into a place and say, I really don't know what you do, and I really need you to teach me. And that helps you form a relationship that's a lot better from the beginning, because you're learning from each other. And then you can kind of tackle those issues together, because nobody's kind of going in and saying, I'm auditing you today. And it's hard, especially when you walk into a new place and you say, hi, I'm the IP, because some people all automatically think, oh my gosh, you're here to audit us. You're here to, check what we're doing wrong. But when you just say, hey, I'm here to just kind of learn what you do, it's a fantastic relationship. And for my team now, we always just go and we ask if we can just shadow one of the team members, if we can help them. And it's been a really great relationship. And so now when we're there, they kind of just talk to us. They tell us what they're doing, what's going wrong, what's going right. And it's really great. But you kind of have to have that humility in the beginning to say, I would really like to learn what you do. And no matter where you start, where you want to go, if you're in the OR, SPD, you're an IP, wherever you want to go, have that humility to go to the person that you want to learn from and say, I really want to learn what you do.
I'll be honest, in all of my interactions on the clinical side with IPs, I've been very impressed with that natural humility. I don't think I've ever come across an IP that has presented as, I know more than you, and I'm going to teach you. Like, they're almost always coming in saying, teach me, let's learn together. And I mean, that's a pretty unique attribute in healthcare in general. Even like, sterile processing kind of struggles with that sometimes of, thinking we know more than what we know. But there's something in the water in that IP department, because they are coming in with that natural, I need to know more than what I know. I want to know more than what I know so that I can help you and so that we can help each other. And I mean, that's just a great call out. So, kudos to you and the whole IP industry. Anyone who's listening, you're doing a good job there.
We had to learn that we have to be able to say, I don't know. And I think that is unique to IP or not just IP, but definitely to IP, because our field is constantly changing. And there's always something new in the news, some new organism, some new outbreak. And so if we pretended to know everything all the time, then we would fail. So being humble, having humility, and learning to say, I don't know, but I'll find out is critical to success in infection prevention.
Well, speaking of, I don't know, we're going to kind of be moving to our close here, but this interview kind of got prompted with the conversation that we were having on LinkedIn around PPE, and you brought up the AAMI PB 70 2022, and I had never heard of that before. And so I was like, you know what, Jill, I want to get you on the podcast to just give us a little intro into what this document is, what it's about, why it matters to the industry at large, and why, in particular, to sterile processing, why we may want to familiarize ourselves with that. So what is this PB 70 and why should we care?
Yeah, so PB stands for protective barriers. And so what this document from AAMI talks about think about your gowns and the critical zones, which you may or may not have heard of before, but there are places on gowns, like surgical gowns and isolation gowns, that are specifically tested, and we call them critical zones, which are the areas that basically are protecting you from blood and body fluids and whatnot. So when you hear of an AAMI gown that's rated a 1, 2, 3, or 4, this is actually where that comes from. And so a lot of people hear oh, that's an AAMI level 3 gown, but they really don't know where that actually originated, but this is actually where it originated. So we haven't updated this document for a long time. We've been working on it for maybe 4 or 5 years, but now it's finally published and updated. And we, in our committee, our AAMI committee, we made some significant changes. We were really set on making sure that there was a specific decontamination gown category. And that, I think, is very significant for the sterile processing community. And we're trying to make sure that everybody knows that it's out there, because in the past, it was just kind of rolled up under another gown category. And decon really needs its own standards, its own category, so that everybody in decon knows this is really the standard and the level of gown that we require to keep us safe. And so the reason that's significant is the manufacturers will hopefully, I don't know how soon, start manufacturing gowns that actually are labeled as a decontamination gown. Because this just came out, we won't see that happen for a while, but we will start to see that happen. And that was another part of the standard, to have a new part of the standard, to have gowns that are labeled specifically for the type of gown that they are. Until then, we can start to make sure that everybody has the level of gown required for decontamination, which is also really important, which a minimum AAMI level 3 is required for decontamination areas. And so that's really significant too. So until we start seeing those decontamination labeled gowns manufactured, we can make sure that everybody knows that this new standard is out, and that it does. And there's a lot more in it except just this one little piece, but this is the part that I think is really significant, is that you need to have at least an AAMI level 3 gown for decontamination. And I think that will really help people make sure that they have the right kind of PPE in sterile processing and decon for their staff, and that people remain safe.
So, Jill, if you look at the AAMI website, it says this about PB70. It says a document does not cover PPE equipment such as medical gloves, surgical masks, or goggles, nor is there an industry consensus for best practices concerning the gown to glove interface. And I'll tell you, this has been a very recurring theme in our discussions is that interface. And, how high up should they go? What should be, the mill of the glove to make sure, that it's durable enough because you're handling sharps, but still something that you can put on? And how do we prevent that decontam water from the sink from getting down? I mean, we just talked about how important it is to doff correctly. Imagine having all that decontamination water all over your hands inside of your glove. So I realize, the document's not covering that, but it's also saying that there really isn't a consensus. And so I just wondered, could you give us some background on where the debate is and why they're not ready to address that? Because I'm going to say it that way. I know it's not in there yet, but the way that they worded this and addressed it makes me think that they want to get there. But there's something going on in terms of a difference in opinion that's preventing that. Can you talk about that some?
Yeah, sure. So our document is, just as a reminder, it's not just for sterile processing. And so this document is about gowns mostly. It's also about surgical drapes. And so it is not just about sterile processing and decontamination. If it was, then I would be certain that there would be more emphasis on things like this. But since it is about protective barriers in general, we have not spent the time that would be required to be able to address such issues like this. I will say there is research going on about the gown glove interface that is very interesting and telling. And there's a lot of members on our PB committee that are contributing to a lot of that. I don't think that there's, like you said, why it says that, because there isn't consensus yet enough to say definitively that this is what we're able to do for it. But this document isn't just for the decon area of sterile processing, and that kind of time and dedication hasn't been able to be had for that particular topic, though it's very important. So I do think that there needs to be a focus on it. I don't know that this particular document would be the place for that to be placed, at least right now. We may need to address it in a different venue, or maybe in the TIR document. So there's also TIR documents that go along with these standards that can suggest kind of process related guidance to go with these documents. So that may be also a way to go when kind of looking at these protocols that help you implement the standards.
Yeah, so that kind of goes back to what Hank was saying before, that this is not an SPD nuanced AAMI guideline or AAMI standard. This is something really global, and it's not intentionally left out as much as it's really not the scope of the project. I totally understand.
Right. Not that it's not important. It just was not the focus, because there were lots of focuses in this document.
So, something tells me I'm not going to be the only one that this is the first time that I've heard about this document. So folks are going to want to connect with you, Jill, and probably ask some more questions.
Yeah.
and continue to follow the conversation. So what's the best way for them to follow you and get connected? And are you speaking or educating anywhere the rest of 2023 that if folks want to track you down in person, they can come see you?
Yeah. So of course they can follow me on LinkedIn is probably the best way. I know that's kind of where the sterile processing community seems to be the most active. So that's probably the easiest place. And I am speaking at HSPA this year. I'll be speaking on Wednesday morning, and I'll be talking about sterile processing outside of the OR areas. So happy to connect with anybody that's attending. We are doing an educational session through AAMI that's about the entire PB70 document, myself and my co-chair. So that's always an option as well if anybody wants to sign up for that webinar. But happy to talk to anybody who has additional questions or is just curious about how they can make sure that their facility knows that they need to have this level of protection. But it is really important. But now you have that kind of backing to say, this is what we have to have. It's a standard. And this is what's required for us to keep everybody safe.
All right, Jill, great job on the interview. But honestly, like Hank said, this is the first I've heard of PB70. So I will definitely be picking your brain at HSPA. And again, this will air afterwards. So I'll be an expert, everybody, by the time you listen to this. Thanks to Jill. But Jill, great job. Thanks for coming on the show.
Thanks, guys.
Jill Holdsworth, everybody, manager of infection prevention at Emory University Hospital Midtown, and talking about infection prevention's role in PPE. And obviously, everybody that we speak to is very much interested in sterile processing because we're the voice, the global voice of sterile processing. But we work with a lot of other departments within the hospital, and IP, depending on where you work, might even be your reporting structure. Instead of the OR or materials management, you may be reporting up through infection prevention nowadays. But I think it's an important distinction, Hank, that you made early on and that we kind of reinforced when we talked about the AAMI PB70, which is IPs have to be able to speak to all the various departments within the hospital around their practices. And so on the one hand, that's an asset, but it's also a lot of responsibility for infection preventionists. And on another hand, it's a great opportunity for sterile processing to educate about the nuances in their department to help their IPs be stronger. So that collaboration, we've talked about it since very early on. I remember an episode going way back with
episode
Mike
1.
Matthews. Yeah. Episode one. That's right. Yeah, literally way back to the beginning.
Yeah.
And talking about the importance of engaging IP. And here we are still talking about it today, especially with somebody so noted in infection prevention with Jill Holdsworth.
Yeah, she's not going to be a new name to folks who consume a lot of Beyond Clean education around conferences, especially. She's been on a number of panel discussions and conferences with us. But yet, it's great knowing folks out there in the space like Jill because they got their finger on the pulse of what's coming out new. You know, that PB70, this is a big update and there's some new information in there. And so I'm taking away, from this of, hey, it's good to self-educate. It's even better to self-educate and know other people who are self-educating because then you get to glean that insight and that knowledge from other people that you don't have to be the one doing all the research and, reading all the news. If you have those people in your network that are sharing that information, you can still benefit from it. And that's what the podcast is all about, Justin, like we have been since episode 1. And as we wrap up this season, it's a fantastic reminder that, PPE is a basic, fundamental to sterile processing, but there's nothing basic about the information here. There's a lot to know and to learn.
Yeah, we spent a whole season on it and loved your plug in the middle for podcasting and all the various new ways of keeping yourself educated and the theme around training that came up as we discussed this episode as we discuss PPE with Jill on this episode. So like you said, it wraps it up for the season, but we've got this and lots of other educational content and discussions and podcasts available on our smartphone app for iPhone and Android. We really want to encourage you to download that because some episodes have bonus content. That's additional materials, usually a PDF that has information to complement the interviews. And we also, while you're there, would love a rating and a review. You can listen to us on any podcast application, though, so just search for Beyond Clean Podcast if you're already listening to podcasts. More importantly, what we really like is to get the engaging discussions happening on social media. LinkedIn is one of the best, but also Facebook. Certainly like, share, and especially comment on the post for this episode if you liked what Jill had to say, or if you got something to add. You can connect with Jill on LinkedIn. You can connect with Hank or myself. Just send us a connection request and email as well. If you have anything that you want to share in terms of feedback for the show, you can send that to info@beyondclean.net. And on behalf of Hank and myself, thanks for listening to this episode, the final episode of the season of PPE on Beyond Clean.